My name is Shelby Hyde. I'm a registered nurse. I'm also a student in the MSN education program at the University of Texas at Arlington. We're going to talk briefly today about osteoarthritis. To start off, we're going to talk about the types of joints in our body. There's the fibrous joints, which are non-movable. These are like the sutures in the cranium. There's cartilaginous joints. They're somewhat movable. Those would be like where the ribs attach to the sternum. And then there's the synovial joints. These are our highly movable joints. And those are the joints that are typically affected by osteoarthritis, or OA. Typically, OA affects the hands, the knees, and the hips. So normal versus abnormal. In the normal joint, the cartilage is smooth, the meniscus is a round disc that provides good shock absorption, and then there's the bone, healthy bone. In the joint affected by OA, the bone starts to be exposed because the cartilage is breaking down. And the meniscus begins to erode, does not provide that shock absorbing benefit, and then bone spurs begin to develop. So there's some modifiable factors related to OA. So exercise, trauma that happens during exercise should definitely be dealt with properly with the right medications, medical visit, work-related injuries, and then injuries that occur during sports activities. Another modifiable factor for the prevention or reduction of the risk of OA is obesity. Then there are some non-modifiable things, some things that we just can't change. Aging. We can't change our aging. There are some restorative kinds of things that the aging person can do, such as an appropriate diet and exercise program. Actually, OA affects the older person more commonly and is mostly diagnosed in people that are age 65 and older. And then also genetics. If your parents have OA and your grandparents have OA, then you would typically have a higher risk of having osteoarthritis as well. And then diagnosis. So this is going to be a group of components that we make this diagnosis with. Health history and symptoms, a physical exam by your physician, and then diagnostic testing. That would be like a joint aspiration done in the physician's clinic, x-rays, MRIs. Those three things tend to be the gold standard of providing a diagnosis of osteoarthritis. And then what can we do? So treatment, medications and interventions. Typically, analgesics and anti-inflammatories are prescribed. Injections into the joint, that would be done in the physician's clinic. An exercise and stretching program. Weight management program if obesity is a contributing factor. And then therapies, occupational, physical therapy, and as a last resort, surgery. So I want to tell everybody thank you for watching my video, and here's a list of my references. Thank you.